All right, guys, we are in our next section, which is person-centered care. I'm going to go ahead and pull this up for you guys so we can get going. And I guess I should say guys and gals. So let's do this here. And, oh, I need to share the screen. And you'll note my door is open, okay? I know that's been the topic of probably a lot of people saying, well, he says he's got an open door policy, but... So let's go ahead and get after this. So person-centered care with response to resident and family engagement. So the objectives here is that all the participants will understand the definitions of resident and family-centered care, the key concepts of resident and family-centered care in the long-term care setting or the CLIF setting, the importance of engaging residents and family members, the significance and challenges of effective communication. Now, I'm going to switch over to this video here and get us going. So, overview. What is resident and family-centered care? What does person-centered care look like? Traditional care versus person-centered care, and how person-centered care benefits everyone. I'm going to give you guys a spoiler alert. When we think person-centered care, it's care that's designed around the person, i.e., them making their decisions and being a part of their care. So let's continue on through the PowerPoint. What is resident and family-centered care? A way of thinking and doing things that keeps the resident and their family at the center of every decision-making process. You don't say. Care focuses on residents' choice and individuality. Care that reflects dignity and respect, information sharing, participation, and collaboration. What does it look like again? An environment that embraces the individuality of the resident by eliminating the assembly line approach to care. A combination of resident choices and preferences, thereby improving the quality of care and the quality of life. Equipment staff with knowledge and decision-making ability so that they can effectively engage residents as partners, and collaboration with residents, advocates, and long-term care ombudsman programs. We do not have ombudsmans at this level of care. So again, we've talked about this multiple times about Medicare ombudsman. If there's an issue that needs to be reported, it goes directly to California Department of Public Health, Fresno District.
An extra hug.
I gotta mute my phone right now. It's making some noises. And let's continue on to the next section. So traditional care, the decisions about policies, procedure, and work environment are made exclusively by management. Frontline staff are not involved in the decision-making process, and care is driven by diagnosis care, tasks, and the individuals who perform the tasks. Where a person-centered care is that the management works with the staff, residents, and family members to accommodate resident choice and preferences. You guys will be working directly with Raymond and myself. We will be out there on the floor working with you guys. Your opinion matters. Please feel free to share it with us and, be comfortable. We really want to promote almost like a family-like environment here, okay? Staff are empowered with knowledge and are included in the decision-making process. Yes, you will be. Residents are given a choice and have input surrounding their care, and care plans are based on their needs and preferences. So let's talk about family members. They should have the ability, the patient first, should have the ability to direct their own care, have choices which can encourage engagement and improve quality of life, thrive in an environment that promotes trust and respect, and receive care from staff that are dialed into resident preferences and needs. They achieve the best quality of life possible. Definitely don't want quality of lice. Okay. So person-centered care helps staff members establish a better partnership with the residents and their families. It helps the staff members to understand the residents' preferences, which allow staff to anticipate the resident and family needs. They feel valued and respected in person-centered care organizations. That is true. So the benefits by this would be increasing the ability for staff to identify and respond appropriately to changes in a resident condition, increasing referrals from resident and families who had a positive experience and recommend the CLIF to others. So the biggest marketing tool that we have is the patient who leaves this facility happily, right? We know that not everyone's going to leave, but we want everyone's family member and every patient that comes in to have just the best experience, okay? Because we know being sick sucks, and we want them to have a good interaction during this time that they're here. So let's talk about the engagement. What is resident and family engagement? What is the importance of the engagement? How are ways to engage with residents and families? And what is a care plan participation? So engagement is an important aspect of person-centered care. It creates an environment where residents, families, clinicians, and faculty staff or facility staff work together as partners to improve healthcare quality and safety. It recognizes residents and families as members of the healthcare team who work with clinicians and leaders to improve the quality and safety of care. When residents and family members are engaged in care, outcomes improve. That's a fact. This includes, but it's not limited to, higher levels of resident satisfaction, improved clinical outcomes, improved staff job satisfaction, and reduction in staff turnover. These are some different ways to engage residents and families. We're going to develop relationships with residents and family members to get to know them as individuals and take time to have meaningful conversations. Some of the best interactions I've had with patients over the years as a bedside caregiver was that with the family dialoguing about some new scripture that I had learned, or, the local team, the Giants. Whew, a lot of people are Raiders fans. All right, let's hear it. Not a huge sports guy myself, but whenever I had a patient that wanted to talk about motors and was a gearhead, my gosh, it was hard to get me out of that room. So, what else? Find out about each resident's likes and dislikes as well as their preferences for care. Encourage a resident and family participation in the care plan development and care conferences. Establish open lines of communication so that concerns and needs are cleared, and educate resident and family members about changes in the faculty or facilities policies and procedures, just in case. Okay, what are some things that it's helpful to when it comes to participation in care planning? The family members are going to help encourage the residents. That's really what's going to go on. I know that this slide is telling us to encourage a resident, but if there's a family member that is a patient advocate, that patient's going to do well and thrive. It's our role to accurately assess the residents' care preferences and to provide an opportunity for residents and families to discuss their needs and concerns. We're going to give residents and families access to information in a manner that they can understand. We talked about jargon in the last slide, or I should say in the last presentation. We're going to ensure that staff has the residents' preferences accurately documented on care plan. Communication. Listening to residents and family members, explaining care plans, communicating changes, communicating challenges, and addressing the communication challenges. So listening to residents and family members, here are some ways in which we can clearly communicate to the residents and family members. We can use open-ended questions. We can listen to, respect, and act upon the residents and family members' comments, concerns, and requests. We can help residents voice their concerns. Use a translator if the resident or family speaks a different language or has a disability that makes it difficult for them to communicate. Guys, we have translation services that we've secured through a contract to where we can call. We have translation services at the drop of a dime. Let's say that someone has some hearing impairments. We also have the ability to have a video communication with the translator. So it'll be helpful for us. You just have a lot of tools here at our disposal. We can also share specific resident preferences with everyone on the care team. So that comes back to our interdisciplinary communication forums. Let's talk about care plans. The care plans help the resident and family understand health conditions and issues by reviewing the care plan with them regularly. Some helpful tips to keep in mind when explaining the care plans include, but are not limited to, take every opportunity to educate the resident and family in a way they can understand. Use plain language and avoid excessive medical terminology. Encourage the resident and family to take notes and ask questions. And follow up with the resident and family to see if they understood the information. I am having a little bit of a computer issue here. That's okay. Okay, communicating changes. It's important that the resident and families are kept informed of changes to facility policies and procedures. Ways to communicate changes may include, but are not limited to, newsletter articles, town hall meetings, resident or family council meetings, care conferences, and posters. Clear communication can come with challenges. These may include, but are not limited to, residents that are hard of hearing, have cognitive deficits, or speak another language, family members that visit infrequently or have language differences, and staff that have a lack of experience and or confidence with effective communication. The last slide on this is addressing those challenges. Find out how the resident and family members prefer to receive information. This all happens with just getting to know the patient. Utilize face-to-face communication methods to promote visual contact. It goes a long way to look someone in the eyes, very compassionately as well, and share with them. Okay, offer written materials to provide useful content in a different format. Plan to repeat information multiple times in different ways, so we don't want to sound redundant, but we do want to make sure that they're getting the necessary information. We're going to plan to, oh, we already said that. Oh, I guess I plan to repeat. I'm planning to repeat, right? Yeah. Use teach back to confirm the resident and or family member understands. And we are not going to even address that last item because we do not have an ombudsman. So we're getting pretty close to the end. I know we have a selection of videos that is going to come across to you guys through Paychex. So for now, see you on the next one. Good night. Well, I guess it's good night for me, but could be good morning for you.